Paloma Hatami is a thinker and a doer. She holds degrees in arts, commerce, and law. She's a partially completed PhD and advanced qualifications in nutrigenomics and medical genetics, including genetics and genomics studies through Stanford University. As an entrepreneur, she founded and sold Oscar Wilde, built Actionable Genomics, and leads MyGene, an evidence-based Healthspan company focused on personalized longevity and performance. She's also the founder of Therapeptics, which focuses on pharmaceutical-grade peptide manufacturing in Australia and training doctors in peptide therapy, as well as Therapath Medical, which is an online medical practice focusing on peptide therapy and longevity. Paloma was also featured in my latest book, Bigger Isn't Better. You can find her at mygene.com.au and therapath.com.au. Paloma, welcome to the podcast.
Thank you so much, Brad. That was a mouthful. And you did a fantastic job, by the way. Thank you.
I should say welcome back to the podcast. It's your second appearance. I'm delighted to have you back. Why didn't you finish your PhD? What have you been doing?
It was a few years ago, and I had started a few businesses, and my PhD supervisor at Melbourne University said to me, "Can't do a PhD and run 3 businesses at the same time." And I said, "Yes, I can." And he proved me wrong. So that's why. But I will go back to it. It was in law, and I will go back to it. I've got a different topic this time that I would like to explore.
Excellent. You are an incredible and inspirational human. So
Thank you, Brad. So are you.
When people hear the word peptides today, they tend to fall into 2 camps: the future of medicine or biohacking nonsense. Which one is closer to the truth?
They're both as close to the truth as you can get. So first of all, I have to say that a lot of things actually start with the biohacking group. So a lot of these novel therapies can start with bodybuilders. For example, hormone replacement therapy or testosterone replacement therapy. A lot of very good bodybuilders have a better knowledge of the endocrine system than a lot of doctors do, or even endocrinologists. It starts with a niche group of people, and then unfortunately can go in a number of different paths. And now, because of the advent of social media, we have a lot of influencers that are getting on the bandwagon to get more likes. And unfortunately, that leads to a lot of misinformation. But it is the future of medicine. There's actually 2 things we always say a future of medicine. One is gene editing and gene therapy, and one is peptides.
Awesome. I read an article, I think it was the New York Times recently, and it basically said that Los Angeles is all about peptides right now. So for someone hearing the term for the first time, or for someone who is perhaps, knows just a little bit about it, what actually is a peptide and how does it work in the body?
That's a really good question. That's part of the onboarding that we do with patients, because a lot of people don't know what peptides are. So peptides, anything under 50 amino acids in the body is generally considered a peptide, and anything over 50 amino acids is considered a protein. So they could be signaling molecules or precursors to proteins, for example. And the body produces, depending on how you interpret what a peptide is, either hundreds or tens of thousands of different peptides in the body. So we call them biologics because effectively they're what the body produces, but because of age or genetics or injury, we start getting depleted of these incredible little molecules. They are obviously not like hormones, but they can be signaling hormones or help with signaling the actual hormone release. So the same way that our hormones get depleted as we age, again, due to genetics or lifestyle or even environmental toxins, for example, it's a similar effect that happens with peptides.
Why should high-performing, busy entrepreneurs and business people be interested in this topic?
Well, that's a very good question, Brad. It depends on what the issue is. So these peptides are actual medications. So a lot of these sit on Schedule 4. So the oldest synthesized peptide in the world is insulin. People don't know that insulin is actually a peptide. It used to be extracted from pigs. And over time, they decided to synthesize it because obviously it's a lot more consistent, the quality, and it doesn't carry zoonotic diseases. And zoonotic diseases are diseases that can cross the blood-brain barrier and can occur in animals and then, of course, be transmitted to humans. So that is one of the oldest peptides that is synthesized. So a lot of people know of Mounjaro and Ozempic. They're also peptides. In fact, oxytocin is a peptide as well, and so is human growth hormone. So for busy entrepreneurs and executives, why would they be interested in this space? Because likely they have heard about it. Likely they have personal trainers that may be asking them to, for example, purchase these things from sources that may not be ethical sources online, or even they could be selling them themselves. So I would, I suppose, caution against that, because you really do not know what you're getting. And we have a mass spectrometer as part of our pharmaceutical company that we have set up, and we test these peptides in-house for ourselves. The testing is not open for the general public. And the things we find in these peptides that are being sold are pretty horrific.
Yeah, we would dig into that. So last time when you were on the podcast, we spoke about genetics and Healthspan and how to optimize one's Healthspan. What have been the biggest shifts in Healthspan or the longevity space since we last spoke a couple of years ago?
I would say peptide, the advent of peptides and the mass marketing of peptides, and also to some degree gene therapy, which is not available to a lot of people because it's extremely expensive. And unless you have a disease, it's really not in the public vocabulary. But now they are using it in various different countries like Mexico, Ukraine, etc. Again, I would caution against people doing that. But I would say that peptides would be the biggest trend and the biggest explosion in longevity, because these molecules are actually exceptional and they do really have a profound effect on the body.
Can you give us an example of gene therapy and how that can be used practically? And can you give us an example of peptides and how that can be used practically?
So with the gene therapy, they have managed to cure, say, one gene diseases. So what they do is they use a vector, they add the section of the gene that is faulty, so the gene that needs to be carved out, and then they inject that into the person. It's a very, very expensive therapy. They have managed to cure some very, very rare cancers, for example, but one injection could cost $500,000. In terms of biohacking, there is a gene that effectively allows you to build muscle mass, and then it actually stops because you can't continue to build muscle mass. And as we age, our muscle mass goes down. There is a gene therapy that they are advertising where you can actually go to Mexico and spend, I think it's about $500,000, where you get injections all over the body to supposedly, implant the gene and carve out the gene that allows the muscles to break down for you to be able to just continue to build muscle mass. So you see those cows, for example, that have huge amounts of muscle. I don't know if you've seen them. I don't know what the names are, but they look like massive Arnold Schwarzenegger's, like huge, big. They've got this particular gene where their actual muscles don't break down, so they continue to grow. I know of a person that has done that, but they have had no effect whatsoever. So they wasted, I think it was $500,000. And again, I would caution against things like that for biohacking. I believe Brian Johnson's done that as well, the biohacking guy. I'm not sure whether that's worked for him or not. According to him, it has, but obviously we can't verify it.
So there's extreme cases like that, but what you said in terms of genetic, first of all, was it can cure some diseases is one of the big changes, and then peptides. Now,
Peptide therapy, yeah.
Peptide therapy, for peptide therapy, there are, I think there's what I've seen are some really simple applications, e.g. someone's had a consistently sore shoulder they've had peptide therapy or they've injected peptides into the sore shoulder to make it as simple as I can. And that has caused that pain to decrease or go away for a period of time. And then cognitive improvement and some other things. So what are if I'm not incorrect in those simple examples, what else? How can we use peptides broadly as
So that's a very good question. There are, as I said, hundreds, depending on how you classify peptides, hundreds of thousands of peptides in the body. So there is peptides that heal your skin, heal wounds, increase libido. Obviously, with insulin, it adds insulin to your body. They blunt your appetite. So there are so many different uses for peptides. In terms of what peptides have been have human clinical trials, that's the biggest issue.
Yeah.
So, for example, Mounjaro and Ozempic or pharmaceutical products like that made by Novo Nordisk or Eli Lilly, they go through 10 years of clinical trials, phase 1, phase 2, phase 3, phase 4, hundreds of millions of dollars spent. And so they have been found to be safe. And what they do is depending on whether it's Ozempic, Mounjaro, or Wegovy, I prefer Mounjaro at this point because it's third generation drug, and there's another one coming out which is even better. They can have a pleiotropic effect, pretty amazing. They change your relationship with food. They blunt your appetite. They can reverse atherosclerosis through the mechanism of reduction of blood glucose levels, for example. They also have a modulatory effect on the brain where people who have had long-term addictions for alcohol, for cigarettes, for whatever it could be, they actually don't feel like doing those things anymore. And also it reduces inflammation. Problem with some of those drugs isn't the actual drug, but is the abuse of those drugs, where the doctors are told to start with low dose for 1 month and they double it the second month, then they double it again the third month, and they double it again the fourth month, then it goes up to the 5th and 6th month. That is where you lose massive amounts of muscle mass. You can have a lot of side effects to it as well. So doing it properly means setting expectations for the patient, teaching the patient how to eat properly and exercise properly, and putting them on the lowest dose so they can lose the weight gradually and without losing the muscle mass, which becomes so very important as we age. In terms of the novel peptides that a lot of people are talking about these days, which is, for example, body protection compound 157 or thymosin beta 500, which is a segment of thymosin beta 4, those have not had any human clinical trials. They've been around for many, many years. Some of them were discovered in the Eastern Bloc maybe 30, 40, 50 years ago. And therefore, they're not patented drugs. And pharmaceutical companies are interested in a patented drug so that they can have a period of 10 years to be able to maximize the investment of hundreds of millions of dollars they put into it to get that actually back, which is fair and reasonable. So as a result of that, they cannot be scheduled on the TGA. To be a scheduled drug, you have to have human clinical trials, or at least have some clinical trial, and then be sponsored, etc.
This episode is brought to you by Evolution Partners, where we help leaders to confidently build enduring great companies using our proven, structured, strategic planning process that ensures you build and execute the right plan to build the business that you want and the life that you want. Check us out at evolutionpartners.com.au. And you can also check out our books, Made to Thrive, which is about the 5 roles of a CEO. Becoming a great CEO rather than just a good CEO in your business. Second is Onboarded, which is about hiring and onboarding great people, making sure that you give yourself the greatest chance for people to succeed in your organization. And then third is Bigger Isn't Better, Better is Better, which is about building a business that is better rather than bigger. It's not about building a little business. It's about building a business that compounds, a business that you can actually fall in love with again. And that's the challenge as I observe it as an outsider with the market generally. There are patented peptides that are owned by pharmaceutical companies that have had respectful clinical trials and we know the outcome of. And then there are other peptides which could be equally as effective, but
Yes.
don't have a patent, aren't owned by one. And so then there's no one who's really necessarily done the clinical trials, even though they might work. And there's no one who is really managing or controlling the quality. Is that a fair assumption?
There is three things to unpack there. So first of all, with pharmaceutical companies that invest in making these novel peptides, they do not obviously want to touch peptides that have no patent on them. The ones that we're talking about today and the ones that we actually issue scripts through our clinic, they actually sit on Schedule 4. So there's a number of schedules up to Schedule 8, effectively, where the TGA or the government looks at the various different drugs and says this is safe over the counter, or it's got to be scripted in a specific way, or it needs a specialist and it's got to go through lots of checks and balances like opiates, MDMA, psilocybin. I believe they're Schedule 8. So they're the kind of the hardest drugs to get. These particular peptides that we're talking about, and the reason we can legally write scripts for, that they actually sit on Schedule 4. That means the government has looked at them, they've deemed them to be safe, and therefore they've actually scheduled them. There's a lot of them that are not scheduled. Even with those, that it is at the doctor's discretion to be able to write a script or not, because maybe somebody has an incurable disease or they've tried everything and they've failed. And as a last resort, the doctor can write a script for a particular peptide he may know of that may help this patient. So in terms of the quality, that's a separate issue. So the scripting, the doctors are able to write scripts for these peptides as long as they follow very, very strict guidelines set by the TGA to vet the patient and ensure that it is safe for that patient and under very strict conditions with supervision. And that's where a lot of clinics fail, unfortunately. They do not want to put the time and effort in. They act like scripting mills, where they provide patients with scripts and then they get it. There is some sort of I suppose, kickback with the pseudosterile pharmacy that actually makes it. And therefore, and not to say that anyone's doing the wrong thing here, but that's where you see issues occurring. Now, the quality is a whole separate issue, and that's the problem we identified in Australia, that there are no peptides that are actually these novel peptides that are actually manufactured in Australia. Bachem in Switzerland do make these peptides, but they're a pharmaceutical company that only deals with other pharmaceutical companies in terms of raw materials, and it is exceptionally expensive. So to actually even get an account with Bachem is extremely difficult. So what we did is we looked at the fact that these products are all coming from China without exception. Even if they say they're from America, they're imported through China, they're cleaned, and by cleaning, we're talking about very little cleaning, and then they are kind of repackaged as made in America or wherever it is. Often the claims that they're making, in fact, we have not tested one peptide on the market where the purity claim is correct. Not one. So that's the problem we identified. So we looked at the different ways of making them, and that's a really important point to make, Brad, that these peptides, according to the TGA, if you are going to manufacture a drug, all of the raw materials have to be synthetic. Why? Because if they're made from animal amino acids or even plant amino acids, but in particular animal amino acids, which are the cheapest ones, they can actually carry zoonotic diseases like mad cow's disease. They're prions. And mad cow's disease doesn't immediately occur. It starts slowly, and it can take 5 to 10 years. And unfortunately, we see a lot of people that are so worried about their sugar and carb intake, yet they are getting these peptides from their gym bros and they are mixing it themselves and they're injecting it into their bodies. And these peptides can carry huge amounts of contaminants, E. coli, heavy metals, microplastics, and huge amounts of chemicals like TFA.
Yeah, there's a lot to unpack there. As I understand it, the two paths, one is through a doctor and a script, and the other is, let's say, grey imports, probably manufactured in China. What I've seen people do, what I've read people do is they will import something probably outside of the remit of border security. In other words, they're not supposed to be necessarily importing it. A, and then B, when they get it here, they're trying to get a lab to test it's what they've bought is actually what they ordered. I mean, it seems like such a messy and dangerous way to go about it.
First of all, Brad, it's completely illegal to import peptides. So that is an absolute no-no, unless you are there are some companies that have a license, but in terms of people exporting it, it's a complete no-no. There are labs that are we've also identified labs that are set up that to just provide reports which are falsified. And that's even more of an issue. So people are getting reports where something's 99.9% pure, 99.8% pure. To give you an idea, to get that, first of all, what do they mean by pure? What are they actually testing for? Is it the quantity of peptide in the actual bottle? Is it what contaminants are you checking for? Because you have to actually put the molecular weight of the contaminants you're going to check for. So if you're not going to it's like baking a cake, getting it tested, and the cake has, say, no bananas in it, but putting on there testing for bananas, but not testing for flour or sugar, for example.
Yeah.
So it's a very, very difficult area because it's very technical and most people don't understand that. So they be able to get 99% purity, it's pharmaceutical grade in a sterile environment with multiple HEPA filters, with the most expensive machinery, full on suited. It's not a matter of what we're getting from China, which we test for, where we've heard people are putting their hands in it and pulling out these peptides and putting it in bags, and they import it into Australia. People are actually going to China and picking these things up, and then they're sitting in their kitchen tables, pouring them in these little bottles, sticking stickers on them saying 99.9% pure, and telling people, oh, I responded very well to it. Funnily enough, people are responding well to it, but we believe it can be stuff like speed, or it could have bicarb soda. I mean, if you take bicarb soda, it settles your stomach. We actually have seen most incredible stuff in these peptides. It does have they do have peptides in them. They do have between 1 and 20%.
Yeah.
But unfortunately, you are not paying for what you think you're paying for at 99.9% purity.
Why do you think, if these are Schedule 4 drugs, illegal to import, why do you think that people can buy them so easily online and get them?
Because the TGA and the government don't have enough resources, or don't put enough resources into policing these things. It's no different to TRT. You can go online and buy, testosterone. You can buy steroids. You can pretty much buy anything, unfortunately, online. And a lot of these companies actually set up in Australia. Some of them get shut down and then they rebrand, or they set up in places like Singapore, or there's a particular company, I think they actually have Aussie in their name, and they were shut down by the TGA, and then they set up in Singapore. And it says on their website, if it gets intercepted by customs and they confiscate it, we will send you another lot of it, because they know out of every 1,000 packages, maybe 1 or 2 gets intercepted by customs.
Yeah. What are the most common reasons or medical reasons that doctors are prescribing peptides, I'll say legally, today?
I'm not sure about other doctors. I can only speak about ourselves. We strictly follow the guideline, having looked at the TGA, the APRA decisions, how doctors have been prosecuted. So generally it would be for metabolic or musculoskeletal issues, it's quite a broad range of issues. So effectively the patient has to come to us as a last resort. So maybe they've had surgery, or they've had a tennis elbow, or they've got tendonitis, or whatever the issue may be. for a period of time, they've tried physiotherapy, they've tried cortisone injections, they've tried PRP. Now, they don't have to have tried everything, but they should have at least tried some other means of being able to resolve this issue. And they've had no relief whatsoever. And at that point, we assess them, we get blood work done, which is absolutely imperative to make sure that there are no issues with their liver function, their kidney function, their blood glucose levels. All of those things matter because some of these peptides can actually have an adverse effect on those things depending on what it is that you're injecting. But generally, it would be musculoskeletal issues, arthritis, osteoarthritis, tendon tears. We have a lot of athletes. We've got a lot of boxers. We have people from all walks of life, really, and also gastrointestinal issues. We've been able to resolve people with long-term gastrointestinal issues. We've also been able to help women that have had severe endometriosis, for example. But I want to stress that it's not just peptides. We put them on a program. We make sure that the most important things are there, which is proper diet and lifestyle before you add anything else to it. As I tell people all the time, you cannot out peptide a bad lifestyle and diet. You just cannot. It's like trying to build a skyscraper without a foundation, but just put pretty pictures on the wall. You just can't do it. It will help temporarily, but it's like a sieve.
Yeah. It always comes back to that in one form or another. You've got to have the base working well, right? You've set up a pharmaceutical company in Melbourne manufacturing peptides and pursuing GMP standards. So what does GMP mean and what problem were you trying to solve?
So to set up a pharmaceutical company, obviously you don't have to be accredited by the TGA, but we wanted to go for that accreditation because that is the hardest thing to get, the TGA accreditation. It is extremely expensive and very, very difficult. It takes about a year to get it. And what they do, you can't get TGA approval for the peptides because, as I mentioned to you earlier, they are a Schedule 4 drug. There's no human clinical trials for them, but you can get it for the actual manufacturing process. So what we did is we ordered the machinery from Switzerland and Japan. A lot of this was custom-made machinery. That then we set up the actual laboratory. We were very, very lucky to get one of the best peptide chemists in Australia to come and work for us. And then we started the trial because every single one of those peptides is a separate pharmaceutical product. So to get TGA means that every single machine and every single process has to be vetted by the Therapeutics Goods Administration to ensure that what we're doing is correct. All of the raw materials have to be vetted. All of our raw materials are coming from Germany. We do not get anything from China, which means that the product that we produce, even unfiltered, is sitting at over 90%, which is fantastic. Once it's cleaned, we're looking at about 99.4% purity we've able to achieve, which is a phenomenal achievement, really. So GMP is good manufacturing practice, but in effect, what we are doing is the equivalent is sterile. Getting TGA effectively means you have to be functioning in a sterile environment, which again is very difficult to achieve because, believe it or not, there's no standards in Australia for sterile compounding or sterile manufacturing. So we had to set up our own and get some experts that are engineers to design the HEPA filters for us. Initially, we were told we need one, but we actually found out we needed 4. Even the engineers didn't know about it. So it's been a really difficult process, which explains why no one has done it yet, apart from big pharmaceutical companies that are making different products, of course.
Awesome. For high-performing entrepreneurs dealing with stress, recovery, or declining energy, where might peptides legitimately fit? And as I'm saying that, I'm thinking about what you said before, like you've got to have the base. You've got to have sleep, diet, exercise dialed in to a degree. What do you think?
First of all, we can't prescribe peptides for any of those issues. They don't fall under the categories. However, I would say that 99.9% of people who come to us, they would have some sort of musculoskeletal issues. They've had injuries from sports because a lot of high-performing entrepreneurs are also very high. They tend to be high-performing in cyclists or runners or do some sort of training of some sort, or they may just have metabolic issues from old injuries or whatever. So, in terms of what peptides can do for them, peptides are an adjunct to a very, very tight diet and lifestyle, which a lot of these people do. They do have those and they do have these issues. These peptides can do wonders for you. Effectively, you inject these peptides, and even if you've had a very difficult workout, the next day you don't even feel your body. You know how you get out of bed and you have aches and pains all over your body? You almost don't feel it. It is able to resolve injuries that you've had for a very long, long time. Now, I can't say a blanket statement that it does it for everybody. The exposure for different people is different. We've seen people respond in 2 days to peptides, which is phenomenal. And some people don't respond for 2 months. So it depends. It's a case by case basis, which is why it's important to vet the patient correctly and actually supervise the whole process and the program to ensure that they get the best outcome out of that. As an adjunct as well, we do add very specific, high quality targeted micronutrients because as you're ramping up the repair mechanism in the body, you need the raw materials to be able to support that. If you don't have the raw materials, then you're not able to support that. If you're not taking proper antioxidants that target the specific processes that are going on in the body, then it's like a factory ramping up production. It's got a lot of, off products that are falling on the ground that needs to be cleaned out. You need to increase that actual antioxidant capacity of the body, either in terms of nutrients or in terms of diet and lifestyle habits, hopefully both of them. So it's not just a matter of here's some peptides, good luck to you. It's a matter of vetting people and doing it properly.
How does testosterone replacement therapy and hormone replacement therapy, TRT and HRT, sit alongside peptides? Are they separate medical interventions or do they work together? What do you think?
So that's again a very good question. As we age, depending on our genetics again, we start getting low in various essential hormones in our body. For women, generally, if you know when your mother went through menopause, that's around when you'd be going through menopause. So some women go through menopause and finish it at the age of 40 to 43. Not very common, but some women do. That means that perimenopause is about 8 to 10 years prior to that. So they could be going through the symptoms of that 8 to 10 years prior. For women, it's much harder than men because effectively, once your ovaries stop producing eggs, it's like a line like that. We just literally drop, the estrogen drops. And that is catastrophic for women because you have issues like an increased risk of cardiovascular issues and stroke. It goes up by 67%. You have mood issues. You can't sleep properly because your body starts going through these changes where the body's sensing that it doesn't have enough estrogen. Then it ramps up the production of certain hormones, and then there's a cascade of hormones, and then it comes down again. So you go through this yo-yo, no different to when you are a teenager. Effectively, this time it's not starting, it's ending. So women age really hard if they don't go on hormone replacement therapy, which effectively means that you replace the hormones that your body is no longer producing. By the way, for women, that includes testosterone and DHEA. Men and women produce the same hormones, but just in different quantities. In case of women, testosterone almost instantaneously turns into estrogen progestin. But we still need testosterone for muscle function, for a heart. Heart is a muscle. For men, it's the same, except for men in Western countries, they start declining 2 to 3% a year, starting at around the age 25. So it's not like a cliff like happens for women, but your decline is slow and steady. And again, it is essential for men. You put men that are depleted of testosterone on TRT and everything changes for them. Their mood changes, they can build muscle mass again. I often joke, and this is I hope I don't get canceled for this, that if you see a man and he becomes a little bit I don't know how to say the word, but
Grumpy?
Yeah, grumpy. Yeah, grumpy. I know that they need testosterone because they lose that sense of optimism and motivation. And so every little thing starts bothering them. They start micromanaging things. And it happens to women as well. Putting them back on testosterone and seeing the difference is a phenomenal thing. They're very different treatments. One is hormone replacement therapy and one is peptides. Very different things. Peptides can be signaling molecules for hormones, but they're very different mechanisms and they target different things in the body. Together, they work extremely well because usually when women and men go through these changes, either andropause or menopause, they also already have a number of other issues. There could be musculoskeletal issues. It could be gastrointestinal issues. And so all of a sudden you get this real kind of pep up where people feel better, they start functioning better, and cognitive decline. It's so important for cognitive decline for women to get estrogen. And as you know, women, the incidence of Alzheimer's and dementia is much higher in women. And they believe one of the mechanisms is low estrogen. So yeah, I hope that answers the question. I mean, we could talk about this all day, really, on each of these individual topics, but we don't have all day. But
Yeah.
I just want to say how important it is. And unfortunately, because testosterone has been abused in a number of bodybuilding circles, it's not as easily available to men. Having said that, last year, FDA changed the label on testosterone for men, and it's been adopted by the TGA in Australia, where they used to say that it actually harms your heart. But I've always said, well, your heart is a muscle and testosterone helps build muscle. How can it be harming your heart? Now they're saying the opposite. They're saying it actually helps with your cardiovascular function. So there's been a big shift in testosterone therapy. And now if you're past the age of 50, even if you don't have andropause, which means that your testosterone is medically low, if you have some of the markers like low mood swing, motivation, weight gain, etc., the doctor can put you on testosterone. So that is a wonderful win for men.
Thank you. You're right. We don't have all day. We need to begin to wrap this up. What is a book that you would recommend for our audience that maybe had an impact on you?
Oh, look, I read a lot of books. I read probably, I don't know, I've got about 10 books on my bedside table right now that are kind of changed. One of them is about people on the spectrum, and how that is actually, people with autism or Asperger's has changed the world of science and technology. And that it's a wonderful book. I forget the name of it, but I'll get back to you about that. But another one that's completely, nothing to do with any of these topics is called We'll Prescribe You a Cat. And it's a Japanese book. Is by Seo Ishida, and it's become a bestseller all over I think it's New York Times bestseller and in Japan. And it's just a beautiful book to read. It makes you think about just everyday life and just takes your mind away from the kind of very difficult daily things that we do and transports you away somewhere else. And it's got little anecdotal stories. And anyway, it's a great book to read.
So the theme is prescribing a pet to someone who might be in need of a pet. Am I incorrect?
It's actually got little individual stories, and it's about the cats. And it's got stories of how people with specific issues that they go there. It's more like a psychiatric clinic that prescribes you a cat. And you take it home for a week, but they're little stories, and it's great. It's a beautiful little happy book to read, I think, for people.
How can people find you, Paloma?
Therapath.com.au is our online medical clinic. You can always send us a message through that, or you can send a message to mygene.com.au. That's my other company. And you can also call Therapath Medical number, which is 0432 791 791. We're in the process of getting a 1300 number soon, so people can ring up and speak to various different team members depending on what they want to do.
What haven't we covered off today that you hoped to cover off?
There's just in terms of the indications for the various different peptides, what does body protection compound do? What does thymosin beta 500 do? What does CJC 1295 do? What does ipamorelin do? What does copper peptide do? What is retatrutide, and why is it that it's not a good idea to get retatrutide at the moment? You know, there's a lot of questions that people have, and if you do get a lot of questions, perhaps we could have another podcast, and I can address the various different questions that people have, because I do get dozens and dozens of inquiries coming through a day about, I want copper peptides. How can I get copper peptides? Where do I get retatrutide? What does retatrutide do? Or what does, KPV do? Or whatever it is that these acronyms that peptides are named. So all of those questions I will be able to answer if next time, if you want it, if your audience was interested.
Okay. Thank you. Paloma, as always, it's been such a delight. You are a wealth of knowledge and wisdom. And I do feel so very fortunate to have you in my orbit. And before the show, I said you're an amazing entrepreneur, and you kind of brushed it off, but you are truly an amazing entrepreneur. So
thank you, dear Brad. That's coming from you. That's a very, very big compliment. I don't like calling myself an entrepreneur. I just think I like to find problems to solutions solutions, not problems to solutions, but solutions to problems. There's my my dyslexia. Solutions to problems, common problems that people have, but I do take on very, very big challenges. And as I was telling somebody, when I take on a challenge, I burn every bridge. So I've got no way out. I have to finish it, or there is no way back. That's how I do it. It's
burn
not
the
bravery.
boats.
It's just stupidity. I don't know.
No, that's that. Well, yeah, you're a great role model. So thank you again for your time today. It's been a
Thank you very
fantastic
much, Brad.
conversation.
It's always a pleasure, and always congratulations on your amazing book. You're also wealth of knowledge, and also very, very kind, and just a really decent human being, which I don't want to say rare these days, but with what's going on in the world, it is rare these days. So
Thank you, Paloma.
thanks very much, Brad. Have a wonderful day.
Well, I hope you enjoyed the episode as much as I did. If you'd be kind enough to leave a review for the podcast, that'd be really helpful to other like-minded entrepreneurs, and then we can grow our community. If you want to find out more about our guests, head over to evolutionpartners.com.au/podcast, where you can find show notes and other additional reading. Hope to see you back next week. Until then, keep thriving.